Good afternoon, everyone. Myself, Dr. Sugandha Agarwal from the Department of Public Health Industry, BBDCODS, will be taking a lecture on Cpitn index. Development of Cpitn. According to WHO, a WHO organized workshop inviting experts from 14 countries at Moscow in 1977 to examine and advise on the epidemiology, etiology, and prevention of periodontal disease. To develop Cpitn, the criteria was published in 1978, the clinical examination proposed by INAMO and INAM. Later, minor modifications were made in 1982 and has been in use more than 20 years. The original Cpitn divided the mouth into 6 sextants, that is, 17 to 14, 13 to 23, 24 to 27, 37 to 34, 33 to 43, 44 to 47. The clinical findings and observation into 5 code was 0 to 4. The periodontal treatment needs indicators into 4 different treatment need categories, that is 0 to 3. So treatment needed assays usually specially designed WHO color coded periodontal probe for assessment of probing pocket depths around either all teeth or all the WHO designated index teeth. This is a periodontal probe. The ball measures 0.5 mm. Ball to the starting of the black band is 3.5 mm and from the full black band is 5.5 mm. For each sextant, only the highest treatment need indicator is recorded. Probing force is between 0 to 20 grams only, not more than that. That will be painful for the patient. A sextant is examined only if there are 2 or more functional teeth present and not indicated for extraction. Identified after examining all teeth. When only one teeth remains in a sextant, it is included in an adjacent sextant. Index teeth. These teeth have been identified as the best estimator of the worst periodontal condition of the mouth. For adults aged 20 years or more, only 10 teeth, index teeth are examined. That is 17, 16, 11, 26, 27, 31, 36, 46, 47, and 37. For young people up to 19 years, only 6 index teeth are examined, that is 16, 11, 26, 36, 31, 46. When examining children less than 15 years, pockets are not recorded. Now coming to scoring criteria, code X, when only one tooth or no functional teeth are present in a sextant. Code 0 is healthy tissue. This is the healthy tissue, that is the code 0. Code 1, bleeding observed during or after probing. This is the periodontal probe has been used for the pocket measurement. Code 2, supra or subgingival calculus or plaque retentive area seen or felt during the probing. Code 3 is pathological pockets of 4 or 5 mm, that is the black area of Cpitn probe is at the gingival margin. This is a black band is at almost at the gingival margin. Code 4 is the pathological pocket of 6 mm or more, that is the black band of Cpitn probe is almost not visible. It is already into the gingiva. Treatment needs. Treatment needs 0 code healthy or X, that is no treatment required. Treatment 1 is code 1, improving the personal oral hygiene of that individual. Code 2 or 3, need for professional cleaning, root planning and removal of plaque retentive factors in addition to oral hygiene instructions. Code 4 is complex treatment which involves deep scaling, root planning and more complex surgical procedures. Advantages. When compared to other epidemiological indices for periodontal health, the Cpitn is simple and more objective in its choice of cleaning criteria and methodology. The data offers rapid appreciation of periodontal conditions of a population and their treatment needs and personal requirement. International uniformity. Treatment needs provide an indication of the level of complexity of care needed if the periodontal conditions are to improve. Now, limitations. Does not provide assessment of past periodontal disease experience. Does not record the position of gingival margin, that is a degree of recession and level of alveolar bone. Exclusion of important signs of past periodontal breakdown, notable attachment loss and tooth mobility. Absence of any marker of disease activity or susceptibility. No difference between supra and subgingival calculus. No distinction is made between the presence of calculus with or without bleeding. Validity of Cpitn index as a measure of amount of periodontal care needed has not been demonstrated. Now, what is community periodontal index? It was introduced in 1994 by the World Health Organization. In this score 0 is a loss of attachment is 0 to 3 mm. That is cement to enamel junction not visible, and CPI score is 0 to 3 mm. See. Now, score 1 loss of attachment 4 to 5 mm, that is CEJ, that is cement to enamel junction within the black band. See, within the black band. Score loss of attachment 6 to 8 mm, that is cement to enamel junction between the upper limit of the black band and 8.5 mm. Score 3 loss of attachment 9 to 11 mm, CEJ between the 8.5 mm and 11.5 mm. Score 4 loss of attachment 12 mm or more CEJ beyond the 11.5 mm. X is excluded section, 9 is not recorded, that is CEJ is neither visible nor detectable. Advantages: comprehensive measurement of periodontal disease, severity of the disease can be measured, treatment needs can be recorded. Disadvantage: time consuming, calibration will be difficult, involves many criteria. Thank you. That's all about the Cpitn index.